My anus would get very sore. Every day I'd have to put Vaseline around the opening.
Is it a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
When self-harm's that cutting?
I get really, really bummed out sometimes. Just everything's all doom and gloomy.
So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor, I think so.
I've got months to live.
Is that what they've said?
No more treatment, they're giving up on me. And they say how much time I go.
Good morning, Putney Mead, how can I help?
Should I book you in for Wednesday the 5th?
When?
Wednesday the 5th of November?
For today? Don't have anything left for today, unfortunately.
Sorry, Wednesday the 5th.
I don't know how many.
Wednesday.
It's with Dr. Diman. Yeah, it's a lady.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh,
Right, 6 months since I saw you last.
is it 6
It
months?
is.
Yeah.
What's the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted, and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like a little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, before I go to bed. So, yes, there has been problems with my bowels.
Okay, Hans, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. Right. Good. And this one. Good. Okay, fine. And relax.
You did examine me, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Yeah, prostate, I think, probably.
Oh, was it the prostate?
Yeah. You're going to have long fingers to feel your kidneys that way.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff, but I think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So,
Hi.
How are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. So yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I don't know how long it was for, but I wasn't taking any for that period.
Did you just run out, or did you choose to stop?
I ran out and I couldn't afford it again.
Yeah. Okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into like anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that he had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. Only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's really difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay.
Constipated? Or?
Yes, both.
Yeah,
both. I have both. Yes.
She's going to toilet perhaps 6-7 times in the morning and in the afternoon, and then again during the night.
Gosh. Still have a really bad stomach. Everything I kind of eat still.
It's coming straight through.
Yeah.
Is there any blood when you go?
Sometimes, yeah.
And is it loose?
It's more mucousy.
Okay.
Are you passing a lot of gas? Okay.
I can't go out unless I know where there's a loo.
Yeah.
You know, it just winds me up.
So has there been any blood in your diarrhea? Or the looseness, really,
Well,
that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to, this was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the faeces, and it was wet, and that's happened about 3 times, where on country walks, I suppose, in fact it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
Mackenzie.
What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? And any thoughts of trying to do more than
thoughts, but I don't think I'd act on them.
So in terms of today, was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Fine, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing there tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Good morning, Putney Mead. Rachel speaking.
Say ah.
Just look up for me.
Ah.
No. Can't really get to see your tonsils. I mean, I took a phlegm sample. There's a bit of blood in it as well.
Yeah, I don't think I need that sample somehow.
Hi, Onda. Come in. How are you? Sorry to keep you waiting.
You were always late.
I know. I'm so sorry. Come and have a seat.
I haven't got better now because I've been really ill.
Because you saw Dr. Andrews, didn't she, because of your chest?
My chest has been unbearable.
Because you were on some antibiotics initially, were you, or not?
Well, they prescribed them.
Yeah.
And I didn't take them because I thought I don't want to mix the antibiotics and the pump. Because I was taking the pump as well because my chest was really bad.
And have you had any temperatures?
I was getting hot. I thought, do you know what I mean? So lots been happening.
Sounds like it. Let's pop this in here. Okay, so your temperature's all right.
Yeah.
You take your jacket off and we'll have a good listen.
I still got a bit of the cough, but not. Because I'm going away on Sunday.
Are you going to Blackpool?
It's Sunday, because it's my birthday on Sunday.
Oh, lovely.
So
you want to get well for that?
Yeah, so I don't want to be ill. That's what it's, do you know what I mean?
Do you want to lift your shirt up so I can have a good listen? Big breath. And just sit forwards. Again. Chest sounds all right, actually. I can't hear any wheezes today.
Can I check my weight while I'm here?
Yeah, no, of course.
I think I've got on my... Everything's gone pear-shaped at the moment.
On you go. Well, only half a kilo, so it's not terrible.
What,
but,
on?
Yeah, we do want it to go the other way, but...
But to tell you the truth, Dr. Wallace, I'm trying to do it myself before going to Slimming World.
I think you should go to Slimming World. What's putting you off?
I've lost the form.
You've lost the form?
Yeah.
Do you need another one from Laura?
Not being that I haven't done it deliberately.
No, it's fine. I'll speak to Laura and I'll get her to sort out another one for you because I think it is important to have the kind of support of Slimming World.
Also, I've cut down on my drinking.
Good, because that's empty calories.
But I haven't drunk for 2 weeks.
Good.
But I'm going to have a little drink next week. That's because I'm away, so you do, don't you?
No, definitely. It's got to be a combination of diet and exercise.
I mean, my diet is quite good, really.
Good morning. Sorry, I don't know where I'm going in the afternoon.
I've got some pecans, a valuable source of protein and amino acids.
You can.
Oh, God, I've got a bit of old cake in there. Jesus. There we go. Come and have a seat. What are we doing?
Strange comment. One is, I feel like something's growing inside me, but I just wondered your comments. But the other thing is, I notice in the mornings my skin's tingly.
So tell me about this thing growing inside you.
Oh no, it's probably just I'm just overeating. But it just.
Do you think you've put on weight?
Yeah, I've got a massive gut, which I didn't used to have.
And how much weight do you think you've put on?
Oh, I know. I weigh 14 stone.
Okay.
But I haven't been exercising for a year.
Why's that?
Lots of things happened in business, and I didn't have the stomach for it. Pardon me. Yeah.
Your eyes look a bit sore.
Oh no, that's out for a birthday dinner last night.
Oh, sorry.
Yeah.
So how much are you drinking, do you think?
Oh, at least a bottle a day of wine.
So more than you did?
I don't know what I said last time. We all lie, don't we?
I don't know. You know whether you lie or not.
Well, it's about the same, really. Yeah.
So you drink at lunchtime?
Yeah, I like lunches. So lunchtime and always in the evening, anyway.
Yeah.
Yeah.
Should we feel your tummy? I think that we need to do that. So slip your thing off. So maybe we should just do a whole load of bloods again and just check on everything.
That's fine. Just sit down.
Yeah, just lie down.
Lie down. Okay.
Come in. Hi there, hi. Have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because I'm from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. We'll just explain a little bit more about what the prescription is for and.
It's my ADD, as well as I've been having difficulty concentrating and going for a master's right now, and I guess I've been doing without them, and it's not good.
Right. Okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines. But I think in America, it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription.
Do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
It
done.
helps, does it?
It does.
You sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like, I'm just, I don't know. I guess, like, if I did get, like, a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves.
Okay, what's the problem today?
All right, I took the medicine for losing weight, and it's finished.
Okay, if you take your jacket off, we better see if there's any evidence that...
Yeah, I hope so.
Okay, where you go. On your pop. Okay, 123.8. Right, so the last weight we did on you was 5 months ago, and you were 124. So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor.
Right.
I think so.
Okay, well, let me...
a bit lighter, anyway.
So with Orlistat, there are some fairly strict guidelines for us to prescribe it.
Okay.
So continue treatment beyond 3 months only if weight loss since the start of treatment exceeds 5%.
Yeah.
I'm trying to lose weight and it's just not really working.
Okay. I'm going to just wait until it goes 0, 0. There we go.
Okay. So how much weight do you think you've put on?
I'd probably say a stone.
Yeah.
So you've put on 2 pounds.
Oh dear.
Okay.
The body mass index doesn't come up very well with me.
Yeah,
Because
so-
basically doesn't take into account my build.
You probably haven't pushed yourself as much with regards to the exercise.
To be honest, when I get out of work, the last thing I want to do is go work out.
I leave the house at 7, and by the time you come back...
The motivation is...
Yeah, I know.
I want to go yoga.
Oh, yes.
Which is very good.
Yes, very good.
The trouble is, I don't know, I shouldn't say, but it's so grim.
What we're trying to manage with it is preventing things from happening in the future, like heart attacks and strokes.
We're not all sporty, but actually having a think, what you might enjoy from an exercise point of view is worth it.
And you were referred to the dietitian.
Yeah.
Is that happening? Still?
Yeah.
Changes?
Yeah, I changed my diet. But because of my knee, I can't do much exercise. The physio told me I should stop.
Yeah, but obviously your knee was stopping exercise, but the Orlistat was stopped because you'd not been meeting the weight loss target. You know, their role is to help you with your diet and weight loss and exercise and performance. If they think that they're not succeeding and that we need to do something else, they might recommend to us that we prescribe something like Orlistat. The reality, though, is that having had it, it's not really achieved the targets that the NHS dictate to me as a justification for carrying on that prescription. Okay?
All right, can I have a painkiller?
You can have a painkiller.
So was it a good party last night?
Yeah, it was. Yeah.
Okay, up you get. Put your things on. Let's just check on stuff, and then we can see you back with the results. Tummy feels fine. I can't feel anything there that's
just slack.
A bit of slack. I mean, if you can manage to get back to your exercise regime, you're going to feel so much better because you always do, don't you?
Yeah.
Take that, and then you book an appointment for a blood test with the healthcare assistants. Fantastic. And we'll see you afterwards.
Thank you very much.
Okay.
Have a good weekend.
Yes, I hope so. And you. Not too good.
I've got this kind of freckle thing here, which I don't think I had when I was little.
Has it changed at all?
No, it just gets a bit more crispier because I just picked a bit off.
You don't pick and squeeze things.
Squeeze it all the time.
I've got a spot on the end of my nose. And I look at it every morning.
Last Monday, my hand started peeling and all the skin came off.
Pretty classic for something called seborrheic dermatitis, which is triggered by yeasts.
Yes, it feels very much like eczema.
Yes, I get it on my face, on my torso, on my legs.
Okay.
How can I help today?
My psoriasis has suddenly flared up. Over the weekend on my hands and my feet.
Do you mean psoriasis or do you mean eczema?
Well, I was told it was psoriasis last year, but I don't know whether it is or not.
It certainly looks like eczema to me.
Oh, right.
And we haven't got you coded as having psoriasis,
Oh.
but I can check.
With a P, psoriasis?
Yeah, it's a silent one, that's why we call it psoriasis. So tell me about when this came on.
Well, it literally came out like late Friday night, Saturday morning.
Okay.
And it's the same on
show me.
on my feet. You can see where all the little blisters are starting to pop.
It's quite interesting how your skin blisters.
And then it all they all pop. I mean, all of my feet, it all pops open, and then.
What do you normally put on it?
Well, I've been using Chinese herbs on it, which I brought with me.
Okay.
Because I find steroid cream makes it flare up, and then all the skin splits.
Okay.
So
Chinese cream often is made of steroids.
Oh, is it?
Yeah.
Because I find this doesn't work. Those are pills, and then they gave me this. Problem is, it's written in Chinese.
So I mean, I have no idea how safe this is or anything, but there is a lot of people that say that one of the reasons why Chinese medicine is so effective is it's got a whacking dose of steroids.
Oh, really?
Yeah.
I didn't know that.
But not monitored.
Of course,
and so
sure.
not safe from that point of view.
And it would be in the pills as well?
It could be.
Okay.
So I can't recommend them, obviously just because we don't know what there's in them.
No.
There have been case reports of these medications containing dangerous levels of mercury, arsenic and lead. There was a big case last year which showed that they even contain parts of endangered animals. And although they're sold as being natural, that doesn't necessarily mean that they're safe.
Now, your liver function isn't entirely normal. Are you on any medications at all?
No.
Anything herbal or anything over the counter? Any supplements or anything that you're taking?
Yes, I did take, yeah.
What's that?
That's the it's a natural stuff for, oh God, is that a sexual thing?
Okay, so it's a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
Okay, I would stop that, because do you actually know what's in it?
No.
Let's stop it just in case, because some funny herbal stuff can make your liver test go off.
Okay.
Some medication that's being sold as alternative or natural contains the same ingredients as pharmaceutical medicines. So one example is a herbal remedy that you can take for erectile dysfunction, which was found to contain sildenafil or Viagra, which is a medication that has lots of side effects and can be dangerous if it's not prescribed under the right conditions.
I actually tried one of those Chinese places along the road, and I'm not sure if that made it worse.
What kinds of things did they try?
She was thumping it.
Right. Okay.
And then asking me to like chanting, all that kind of stuff, like fake. I don't think it was.
So probably at the moment, I'm not sure if chanting is going to sort out your neck.
Good morning, Putney Mead. Naomi speaking. Hello? This is Putney Mead. How can I help? Putney Mead.
So how are we today?
Pardon?
How are you today?
Yes, how can I help? How can I help?
Thank you very much. I am not bad.
Not bad, okay.
Dr. Smith? Dr. Smith?
Oh.
That's sore?
Yeah, very sore.
She won't be able to phone you because she's in a clinic. She's in clinic today.
There's a little bit of normal wax in there, but nothing that's causing deafness.
All right, take care. Bye-bye. 100 years old. That's crazy.
Hello there. Come through. Sorry to keep you waiting so long. Come in. Come and have a seat. So how are things with you?
Not so good.
No?
It's a day, so-and-so other day, down with the weather.
Yeah.
And I got months to live.
Is that what they've said?
They say, anything they do make it worse. Now it's come out from the lung, it's my organ. So no more treatment, they're giving up on me. Okay. I'm planning to go in Italy Thursday.
Are you going back to Italy to sort things out, or what's going on there?
Well, I've got a nice flat there.
Okay.
And then give something to the friends, cancel all the banking and all sort of thing, Now, do you think I need something on the plane? Because the plane is pressurized. And with my breathing.
Yes, that's what I wonder. Let's check your oxygen levels.
Okay. The arthritis attacked me in my shoulder, my neck.
Just relax your hand down. There we go.
I'm disintegrate.
But you're still smiling.
Yeah, no, I keep smiling. People say nothing wrong with you.
No.
Oh, my favourite. I'm very fond of raspberry jam.
We know on the X-ray there's a little bit of wear and tear in your spine.
About 3 weeks now, I've had pain all down my leg, and I was worried maybe it was my hip.
Obviously, I overdid it because I think I'm 20 and I'm not.
I'm afraid that's fairly consistent with being 83 years of age.
It's no fun getting old.
Yeah, I know. People say.
Did you ever have TB when you were younger?
No, no.
Never. And just remind me, you were a smoker for quite a while.
Yeah, and not only that, the job I'd done, but that's the coaling and...
What job did you do?
As a coalman.
Right.
You know,
Okay.
you're too young, remember?
No, I am, but I know what they were.
Coal on your back, you know, the old, I mean, I'd done that for 25 years. I carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You know, you either did them or somebody had to do them anyway.
I think what you're going through is related to all that.
Well,
and
oh yeah, I
smoking
do
in the
honestly.
past.
Oh yeah. I can't think of anything else really.
No,
You know.
no. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in the bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips blowing round in it. I'm never again. But anyway, I digress as usual.
I can't do it. It's quite hard. I mean, my granddad's Scottish. Scottish. My granddad is Scotland. There's a wee chance of that. Someone cast me as Japanese once. What? I know. I went, are you serious? She was like, you got that oriental look about you. I was like, no.
So deep breaths. Good. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
that scarring.
Bit of a chest, like, you know.
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
no.
But that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh, yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Big breath and then breathe out as hard and as fast as you can. That's it. But short and sharp, not quite so long. So really try and... But better. Do it stronger than that. Really try and blow the end off. I think that's best you got, wasn't it? OK, you ever sit down.
Okay.
Let's have a little look at your things here.
I tucked myself in.
OK. Do you want a hand? Are you OK? Do you take any regular inhalers or not?
No, not regular.
I wonder whether it might help, because I mean, there's a little bit of a wheeze there, but should we give it a go?
Yeah.
What I want to do as well is talk to the chest clinic, who know you very well, and just get their advice about how safe it is for you to fly, the risk of the cabin pressures and things like that, and whether, if they think it is safe for you to fly, whether you need to have oxygen on the flight. I mean, obviously, having lung cancer, it is going to make flying dangerous because we know you've got a lesion in one of the big airways, and the risk is that could obstruct and make your breathing substantially worse. The other thing is when you've got cancers, it does increase the risk of you having blood clots in the legs and the lungs. So I would recommend getting some flight socks for when you go on to the flight. Don't drink any alcohol, and just try and keep your no alcohol, because that dehydrates you and it increases the risk of you having blood clots.
I got to go there. Maybe because they say the hospital go as soon as possible.
And I mean, obviously you've been told that there's nothing more they can do at the hospital. Have you had any thoughts about what you want to happen or what you don't want to happen as things continue?
We've been talking about the heart stopping. You want the revival, say no, let me go. What's the point? And I hope I'm going to have a nice birthday down there. I'll be 77.
Will you be over there still, or will you be back here?
Of course, I've got to be back here.
You'll be back here by then? Okay.
If you're still breathing.
Oh.
That's it. And this is now fetal heart.
She's got an ear infection and lots of stuff is coming out.
You haven't done anything wrong, but I think that's just got infected. Ugh.
He doesn't want it.
No, he doesn't, does he?
Hold on, sweetie, hold on.
That's a good grip that you've got. Just trying to stimulate his gag reflex. It's not nice.
No.
So mean.
Sorry.
She's so mean. Well done. Over.
I'm Dr. Mackenzie. We spoke a few months ago.
Yeah. Now, when I last came in, I was pregnant, but unfortunately I had a miscarriage. No, that's okay. But I'm pregnant again, which is great. But obviously I'm really, really nervous. Every time I go to the toilet, I wipe and I'm scared I'm going to see blood. I'm just on tenterhooks all the time. And I was just wondering if I could book an early scan, if that's at all possible.
There's certainly not much point in having it done at 7 or before 7 weeks because it can sometimes be inconclusive, surprisingly. So you don't want any negative information. You want to either know that things are fine or not fine.
And do the risks of miscarriage decrease quite significantly after 8 weeks?
Statistically, probably a fifth of all pregnancies are lost as early miscarriages. So about 1 in 5.
Okay.
So having had one miscarriage is, I'm afraid, not uncommon. So cross fingers, not going to happen again this time. But even if it did, the advice would remain, well, okay, let's wait for a normal period. And then you try again. If this one happens the same as last time, well then, as I say, it's sad and upsetting, but it's not the end of the road. To try again is...
If I had one miscarriage, is it more likely I'll have another one, or is it completely...
Completely independent.
Okay.
All right. Oh, gone. Can't be that bad.
Come in. Hi, have a seat. What can I do for you today?
I've just found out that I'm pregnant and I wanted to check in with the practice and
go
through whatever we need to go through.
Okay, is that good news?
Yeah, good news.
Congratulations.
Thank you very much. No, quite sudden. I hadn't come off the pill for very long, so I can't believe I'm pregnant this fast.
Okay. And was it something you were trying for?
Yeah. I came off the pill deliberately, so yeah.
You taking folic acid?
No.
No.
Okay.
I'd suggest taking folic acid and vitamin D.
Okay. The other thing that I have on my mind is that I was training for a marathon. And that's due on Sunday. I'm concerned of running a distance like that in such early pregnancy would have I don't know.
Okay. I think because the risk of dehydration and things is quite high anyway. I know you're not far on. I just wonder to be on the safe side, I'd say no. Is that all right? Sorry about that.
No, it's fine. I kind of was getting there myself, but it's...
Yeah. Okay.
Yeah,
I'm sorry about that, though.
No, that's fine.
Because you'll have worked very hard.
I did. I spent the last 6 months training. Look, this in itself is
Are you desperate to do it?
I was. What's more important to you, your health, your baby's health, or running a marathon in the grand scheme of things?
In the grand scheme of things, you can always enter next time.
Yeah, exactly.
Yeah.
So how are you anyway?
I'm okay.
Okay. So last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look nervous.
I'm so sorry.
Why?
I try to overcome it without anyone knowing that I am very nervous, you know.
What are you nervous about?
I don't know really.
We're just feeling a bit anxious?
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you know, and overcome it.
It's obvious it still plays on your mind, yes, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, okay?
Yes, thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
Bye.
Cool, thank you very much. Have a nice evening.
And you.
All right. Thanks a lot. You're welcome.
Bye-bye. Oh, thank God. Oh, finished.
Hello, Brittany. How can I help?
Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain. I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly.
Oh dear.
This is just this morning.
I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious.
Good morning, Putney Mead, Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't, because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult. So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled, that's all.
I'm falling apart, basically.
Right. Oh dear, OK.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side? No, have a look at everything. Pain when I'm pushing? Yeah. Up and down, does that cause pain? OK.
Yeah. Bet they fractured the bone in my groin.
When?
When they done the angiogram.
OK. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
You can be a good boy and let him look.
Okay.
You can be a good boy.
Yeah.
Hello.
Hello.
Yay!
How are you?
I'm well, thank you.
Come, Mummy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10, more like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm not joking. I've seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you like to get fun
So
one up?
yesterday, I read this. It really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this?
Yeah.
Aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi. Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airway sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay. All right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Did you hold your hand quickly?
Just, whoopsie.
Oh, good. It's all right.
Poor old you.
Come on, Bubba, please.
You got your hands full, haven't you?
Absolutely.
Do you want to just give him a cuddle and then I'll just have a look at it?
Oh, come on, Bubba. Come on, sweetie.
Right, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely. We'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy. Thank you.
Very good.
Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Going down.
Are you still smoking?
I still smoke consulate, cool as a mountain stream.
How many a day?
About 10.
OK. Any thoughts about quitting?
What?
Do you want to stop?
Watch what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important. If you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much more than...
No, she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
OK.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK? And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they, finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless. And I was expecting to see you this morning, I think, to check your blood pressure. When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? That's your body. OK. It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant. Well done.
Yeah. There, that's where your penis is. That's where you breathe from, and that's where Dr. Helm's showing you.
Exactly, exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Richland trees, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
got
off
nothing to
that
do with
area.
your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, son?
I'm not overweight.
Yeah.
No, he says, look, he's laughing.
I'm not laughing. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, ear drops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah,
is...
so I think, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
Mummy. Aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's
Are you?
addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Fulham.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah. Did you do anything for fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she? No. No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she needs a step
Really?
to cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as Have you got a dog?
No.
I
I don't want one. Okay.
Too pain.
What pain? Really? Tell me about it.
My heart. Because I walk in her all the time. It makes me twat. And the walking is there.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
That.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour.
Uh-huh.
Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah.
So it's quite rough in texture, isn't it?
But anyway, you might be able to see it.
Oh, this.
This is.
Just looking at it, it doesn't look like anything sort of overly sinister. I can reassure you that this is not a sinister type of mole.
This is a freckle, very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
OK. Have a good rest of the day.
Great, you too.
Take care.
Thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers?
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you to check on the blood supply to that area.
Does it look like it's got a reduced blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it, yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes. Okay, so it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
It's just based on the opinion of the individual.
When you came last time...
Oh God, no.
Why do you say that?
I'm very flexible. I can't.
You
all
are.
I come here for is to get my medicine.
Yeah.
I
There's
don't
flexibility on both sides.
Exactly.
All right. I'm very flexible with you. Okay. What I would say is, doesn't matter what profession you work in, if someone shouts at you when you're trying to do a good job, it's terribly upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm sorry.
am deaf.
You've obviously had.
I am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, well, we'll leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you.
I know.
Yeah.
I don't understand unless I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS is taken very seriously in every practice, but the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
Let's,
as I
we'll
say,
finish now, all right. I'll get that fine. I'll find out what's happening about that diabetes appointment. Come back and see me in a month. Yeah. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
yeah.
Like, how? They're doctors. Can they just... It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays, it sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Absolutely amazing.
Great.
Couldn't ask for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. Well, the first couple of months, I think I was told it has to regulate out.
And then you've just had no periods for the last 40 years.
Perfect, and I suffered really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine, so it won't be painful at all. Taking it out can be a little bit fiddly because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Absolutely.
Is it left or right arm?
I'm in here.
You've got it in your right arm.
Just there.
Hopefully that will be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you, but you won't be able to feel pain. Okay. So, can you feel anything? Wow. Just releasing the little capsule that I talked about that can form around it. It's out. That's pretty quick.
Oh my goodness.
And I can put the next one in. And you will be done. Just put it on a little pathway just along the side of the original one. Done. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time, and I've discovered that I've had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. And then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, my legs. This is all like water. She said it's water.
It does look like watertight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
Sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very, very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing
Right.
I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. It's I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it. Is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got really. The little things in life, which are the valuable things in life.
Precious.
Just take the dog for a walk on Wimbledon Common with the boy. There's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
yeah. They took me in. They said, your bowel's ruptured, basically. I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No, you're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities,
About the chemotherapy?
Yeah, once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who are who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them. What are you worried about? What worries you? The agony of
it. I know
the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. But with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. I've been his sole carer for the last 16 years.
Right.
It's my son.
Yeah.
And I need to prepare him because he's acquired brain damage. He needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess, you know. So now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
Okay.
he's with guide dogs, you know. He's got a guide. So, but
So there's all that worrying you.
Yeah,
you as well about him.
yeah. His welfare, yeah. His mental state. That's what worries me. Yeah.
And what kind of support ideally do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it, you know, to sort of, you know, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, will you just give us a shout, and we can work it out?
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again, yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that he doesn't run out.
Because I need to get this under control.
Yeah.
The management,
So
the pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right. Nice to see you. Give me a shout if there's anything else.
Thank you very
All right.
much. Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello. How are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamine's made much of a difference?
Not really.
And then, is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, like, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available, just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down and get some of the swelling down.
Yeah.
You're going to have to moisturise well, because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear. Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. Like I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you? Well, thank you. You look great. Like the trousers. Thank you. They're fab. Back at uni, so... Oh, right, OK. What course are you doing again? English literature. Right, yeah. I got a letter from Dr. Ducci, yeah. Yes. And you're on a waiting list for psychotherapy? Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks. Right. When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it. And I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar. Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past. I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence. And were you very vulnerable at that time? I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And brilliant. Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself.
I think you're very self-aware, and you're obviously resourceful, built self-reliance, but just let people in as well.
I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything? Yeah. I think it is with me. Yeah. Have a good day. Thank you very much. Thank you. Bye, Tony.
I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.